Three, two, one, and
Good morning, everyone. Thanks for following us on Facebook Live with Love Nogales. Let's Talk Health with Mariposa. We're here in the main conference room at the Mariposa Community Health Center in Nogales, Arizona. I am Eladio Pereira, the Chief Medical Officer, and we like to extend a welcome to all of you to our weekly or semi-weekly session in which we touch on a variety of topics. Lately, it's been virtually all COVID-19, as it should be. With me are two great guests. Thank you for coming. Dr. Phil Williams to my left, head of Pediatrics, and Fernando Silvas, epidemiologist at the Santa Cruz County Health Department, who has graciously accepted our invitation. Fernando, welcome.
Thank you.
And we hope to have you more often to talk about issues of public health. And thank you, Dr. Williams, for being here. As all of you know, we cover topics that are important to keep our community safe, and I think COVID-19 has been virtually the most important topic since March, essentially. So today we'd like to cover a few things that we believe are essential for health and our safety. So we're hoping to cover the vaccines that we have against respiratory viruses, a little bit about testing, contact tracing, and then if we have time, we'll talk about the neurologic complications of COVID-19 and maybe some of the recent data on masking if we have time. So that's our plan. We'll try to answer some questions if we have the opportunity. If not, we'll answer those through our site. Bienvenidos a la sesión de Mariposa de Facebook Live. Mi nombre es Eladio Pereira, el director médico de la clínica. Tengo dos distinguidos compañeros, el Dr. Williams y Fernando Silvas del Departamento de Salud, epidemiólogo. Y vamos a hablar de las vacunas, vamos a hablar de las pruebas, vamos a hablar de contactar las personas que han estado expuestas al virus, y si tenemos la oportunidad vamos a hablar de la información nueva acerca de las máscaras o mascarillas o tapabocas, y quizás hablar de las complicaciones neurológicas de COVID-19. So the first one is talk about the vaccines. Dr. Williams, about three. So vaccines against respiratory viruses are difficult to make. They don't create the robust immune response that we expect from other systemic illnesses. So we have few, but the ones we want to cover: the influenza vaccine, recommended over 6 months of age, the pneumonia vaccine, and the pertussis vaccine. And I do know that public health officials have been really promoting influenza vaccine. We also know that in the last few months, since the winter, the rates of influenza have dropped significantly because of what we're doing against COVID-19, about hand washing, keeping the distance, masking, all of that. So the rates of influenza are down, but added protection is the vaccine. And we know that the best prevention strategy against influenza is the vaccine, recommended for everyone over 6 months of age. So that's what we are. And so I'm going to bring Fernando into the conversation in terms of public health and vaccination. What do you hear about the flu vaccine? What are your fellow colleagues at the state level? Are they really promoting the influenza vaccine? How do you see that developing with your colleagues across the state?
Well, it's definitely being promoted. Obviously, there's quite a bit of concern about the combination of influenza and COVID in the coming months, and the fact that COVID-19 mimics so many of the symptoms of influenza.
Yes.
It is extremely important that people do get vaccinated so that we can at least attempt to rule out one of the two and address the actual problem rapidly.
Yes, absolutely. And so we want to promote that, as Fernando said, protect our community. The efficacy of influenza has varied over the years. Um, the vaccines are created mostly in historical data. We try to predict what may be attacking this coming year. And it has varied from 40, 50, 60, up to 70% sometimes. But it's better than no vaccine. So I think we want to really work with our community to emphasize the importance of the vaccine to reduce the respiratory disease burden in our state and community. And I want to go back to what you said about co-infection. It's very significant. Those of you who've had influenza know that it can make you really sick with high fever, sudden onset of high fever, 102, 103, sore throat, cough, profound malaise, profound myalgia, and COVID-19 very similar. High fever, cough. I think with COVID-19 we see shortness of breath a little bit more often, of course. You can get influenza, pneumonia, but less often than with COVID-19. So we want to promote that. The second vaccine we must not forget is the pneumonia vaccine. There are two vaccines available. Pneumovax is one. It protects against 23 strains. It's called PPSV 323. It's a polysaccharide vaccine. The recommendations have becoming more complicated now that we have a second vaccine, which is called PCV 13. It's a conjugate vaccine against 13 strains. And what we do now, we actually look up the indications, because up until recently, PPSV 323 was the go-to, then it changed to PCV 13. Now it's going back to the polysaccharide vaccine as a first vaccine. The bottom line is that anyone 65 should be vaccinated for sure. If you have other underlying illnesses, 19 through 64, you should be vaccinated. The choice of the first vaccine will depend on your risk. So individuals, for example, who had a splenectomy, individuals who had cochlear implants, individuals who are immunocompromised, typically those get PCV 13 first, and then a week later we'll do the PPSV 323. But that's complicated for today. The bottom line is that we want to vaccine against pneumonia, and whenever our patients come in, they should ask the provider if they're candidates to get the vaccine. And the third one, in terms of respiratory illnesses, is pertussis. And as a pediatrician, you have seen cases of pertussis. You know how difficult it is. It's just a protracted cough. People get really sick from it. So tell us, before I forget, effectiveness of pneumonia vaccine is about 60, 70%. I think pertussis is a little higher than that. Mm-hmm. So tell us about the pertussis vaccine.
Sure, of course. First, what is pertussis? So pertussis is a respiratory illness. It's caused by a bacteria called Bordetella pertussis. And basically what happens is that there are three main stages of pertussis. The first stage is what we call the cattle stage. So the cattle stage is basically similar to a cold. So you can have runny nose, you can have nasal congestion, you can have cough. Some key differences between pertussis, that first stage, and the common cold or the common flu is that one, fever is not a hallmark. Typically, if you have a cold, you're gonna have some fever. It's not typical, even though it can happen in that first stage of pertussis. The second main difference is that if you have a common cold, over a week or so, the symptoms, especially the cough, it should get better. Whereas pertussis, that first stage, the cough actually gets worse. And then it progresses to what's called the second stage, or the paroxysmal stage. And the other name for pertussis is whooping cough, which is exactly what you see in that second stage. So you basically have, in medicine we call it paroxysms, but basically it's a coughing fit, is the easiest way to say, where the baby's cough, 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 cough. And then they take a deep breath in, that big inspiratory, and that's where you hear what's called a whoop. So it's a very classic noise. I encourage parents to Google it. There's a lot of good videos on YouTube that show exactly what it is. Complications with that second stage is, one, you can have apnea. He could even have seizures. There's been central nervous system damage as well, all from that second stage. And then the last stage is called the convalescent stage, which is basically where the symptoms can resolve. That second stage can last for really weeks. It can last for 2-3 weeks, sometimes even longer. And the third stage can actually last for months. So having said all that, the reason why vaccines are so important is to prevent all of it, basically. So if you look at the numbers, some studies show that if you get vaccinated, your risk of catching pertussis can decrease up to 90%.
Right.
So it really, really does work, as do all the pediatric and adult vaccines.
Right.
So we really recommend that all of our patients get vaccinated.
And in pediatrics, the vaccine is slightly different than in adults. You mentioned the one in adults. We also vaccinate against pertussis as part of a Tdap vaccine. It has 3 vaccines in it. We do know that in adults, the pertussis protection decreases over time. So now we do recommend that adults get at least a one-time dose of Tdap for that added protection. Tdap is also recommended for pregnant women at every pregnancy. Usually third trimester, weeks 27 to 36. So Tdap is really important in that population. And then we also follow some guidelines. If you've never been immunized, then we'll do a series of shots based on the individual. But the bottom line, in pediatrics, added protection, and in adults, we vaccinate one time against Tdap, with the Tdap. The other thing about pertussis is it could be highly transmissible. And we've had situations that have been really difficult for us. And the problem with that is, independent of whether you receive vaccine, chemoprophylaxis is recommended with azithromycin most of the time. So we've had situations where pertussis is present. We need to contact everyone around that person and do that. So a lot of people need to get azithromycin. So it's not just about the individual getting the disease, it's all around us too, right?
Exactly.
We've been in that situation before. So 3 vaccines: influenza, pneumonia, and pertussis. I think Fernando made a case for the influenza vaccine, reduce possibility of co-infection, and then added protection. That's what we do. The second area we want to I'll talk about testing, but I want to move to contact tracing because that's really important. As we know, COVID-19 is transmitted person to person. I think by now we all know how it is. The closer you are, the longer you stay, the higher the rate of transmission. But in the last few months, we learned how important it is to identify contact for various reasons. One, in some cases, they should be tested. And in other cases, they need to be quarantined, and we need to make adjustments to that and prevent infection to others from that group. And I know the health department has done a great job at contacting those individuals. But having said that, we've had our challenges with contact tracing. So I'm going to let Fernando tell us about what is contact tracing, who should be contacted, and tell us a little bit about how we can do better to educate our community about the importance of contact tracing. I know there have been some concerns about that. So I just want to really emphasize the importance of contact tracing, and Fernando can tell us all about it.
Well, contact tracing is when an investigator receives information from a positive case as to who they've been around and who would be a contact. A contact being someone in their circle of acquaintances who has, if they spent time with. Guidance right now says about 15 minutes. That they spend at least 15 minutes of time within a 6-foot distance. Now that would be the official guidance for what a contact is. The investigator will speak to the positive case and try to obtain as much information, background information, to find out who all these people are. It could be just a couple, it could be several, depending on how prolific that person is about getting out. The time frame from which we start collecting this information is 2 days prior to their onset of symptoms. So that anybody prior in the 2 days before that person got sick is also considered, will be looked at to determine whether they are contact or not. The investigator will then either hand off to a contact tracer or conduct the contact tracing themselves, and will make an attempt to contact these individuals to inform them of their exposure. And at that point offer advice and recommendations for testing and to see their provider, and just to make sure that they are quarantining if warranted. They'll try to confirm the information that the positive case provided without giving that positive case's personal information or even their name if it's not okay with that individual. It's always easier to do contact tracing if the positive case allows you to use their name during these attempts to contact individuals. So why is contact tracing important? Well, it helps us prevent or at least monitor people so that we can anticipate or identify if they become symptomatic. It's important to make them aware so they can monitor themselves for symptoms, so they can protect their families, so they take the proper precautions while in quarantine, which would be mask wearing, social distancing. It's important to get tested also if they are close contact to that individual, especially if they are high risk. And it's harder to conduct contact tracing when disease is spread throughout the community in community. This is the prime time to do contact tracing. So we can catch and identify these potential folks that might become symptomatic and ensure that they are quarantining or isolating as necessary so we prevent further spread. So it is really critical. Some of the problems that we've had with contact tracing is the inability to obtain the names of contacts from positive cases. Most people are afraid to give their associates names. They might give you the household names, but beyond the household, they're very leery. I don't know if it's a trust issue. They don't want people to find out that they gave their names. Cultural issues, but in order for them to help their community, help their friends, help their family, it is really important for us to get that information, and we will keep their name anonymous to the best of our ability. Like I said, it is recommended and welcomed when they allow us to use their name. But if they don't want to do that, and we understand people are uncomfortable, we will work that contact tracing without ever mentioning who they were, and we'll try to phrase our questions and our information for the contacts without in a way to make sure that the person who would give us information is not identified. This is not a scarlet letter per se. It's not to shame anybody. It's not to get anybody in trouble. It's just important that they're made aware so that we can continue protecting the community, and they do their part to help protect their family and friends as well.
Great, thank you, Fernando. Hemos cubierto varias cositas. Hemos cubierto la vacuna contra la influenza, importancia de vacunar a todos que tengan más de 6 meses de edad para reducir la posibilidad de influenza y reducir que haya coinfección con el virus de COVID-19. La segunda vacuna es la vacuna contra la pulmonía. El tipo de vacuna que se administra depende de la situación clínica. Hay 2 vacunas disponibles. Y la tercera vacuna es contra la tos ferina. En la edad de pediatría y en adultos se llama el Tdap. Entonces recomendamos a todos que cuando vengan con su doctor pregunten qué vacuna es necesaria para evitar o reducir la posibilidad de una enfermedad respiratoria. Y Fernando cubrió la importancia de contactar a aquellas personas que han estado cerca de aquellos pacientes que han tenido un caso confirmado de COVID-19 La definición es 6 pies, menos de 6 pies por 15 minutos. Y Fernando repasó la importancia de contactar a esos individuos para tomar las precauciones. Pueden ser cuarentena, hacer la prueba y tratar de reducir que el virus se transmita a otros. Repasó los retos que existen. A veces las personas no quieren compartir los nombres con los que han estado, pero es muy importante que lo hagan. Es la única manera de mantener la comunidad segura. Los nombres se mantienen anónimos dentro de la habilidad del Departamento de Salud. Entonces recomendamos que nos ayuden. Si hay alguien que sea positivo, que compartan dónde han estado para así contactar a esos individuos que quizás estuvieran expuestos al virus. Este es el momento apropiado porque los casos están más bajos y tenemos la habilidad de contactar a aquellos individuos para que sigan bajando. Eso es lo que hemos cubierto hasta ahora. Thank you, Fernando, for that information. Speaking about prevention, we talk about masking, and we know that masks are critical. I think at this moment, we hear the public health experts talk about the different prevention strategies, distance, physical distance, hand washing, all of that. But masking always rises at the top in terms of things we need to be doing. And all of them are important, but masks are really, really important because it's a respiratory virus. It's transmitted by respiratory droplets, maybe airborne, we'll see. But it does travel a certain distance. So masking reduces that. We do know that about 40% of infections are asymptomatic. It looks like the masking reduces the inoculum, meaning the viruses entering your nose, your mucosal surfaces are in your mouth. It's called the inoculum. By the way, the load is the actual virus that you give to others. That's the load, the viral load. So the inoculum is less, and it appears that even if you get it, that the possibility of asymptomatic infection is a lot higher. So they look at certain groups, for example, asymptomatic infections can be as high as 90-95% in some areas. So having said that, I want our invited guests to speak about the importance of masking from the public health perspective. I think from the clinical perspective, what do you see out there? Are we masking enough? Do we need to promote masking as a continued tool? So I think maybe I'll let Fernando speak first about the public health message about masking. I see billboards in our highways now. Mask up, Arizona.
Right.
That's the message. So from your perspective, what kind of message you want to give our followers?
Well, it's common sense that masking would help. Early on in this crisis, masking was not necessarily thought to be all that effective, but people quickly learned that it definitely could help, and if anything, couldn't hurt. Well, we realized that asymptomatic individuals, people that might be positive for the infection, but are not showing symptoms, could transmit the illness to others. And masking helped protect others when they wore a mask because of droplets. So little particles of spit and things that come out of your mouth normally when you speak, when you yell, when you sing, those particles get into the air and people can breathe them in. But more evidence is showing that people that wear a mask and are not ill can protect themselves also, because some of those particles will be blocked and not inhaled by them. And as Dr. Pereira said, there are journal articles now saying that just wearing the mask is protecting you from inhaling is more virus. So you are not basically overwhelming your system. So maybe you will have a lesser and a less serious illness, more asymptomatic. So milder illness probably if you're positive, if you get ill at all. So it's highly recommended that you wear your mask in public, that you wear a mask around others, and also include the social distancing. We go out in town, we still see people not wearing a mask or refusing to wear a mask. Now, we all know that it helps others, but now evidence is showing that it also helps you. So please do wear a mask. It is being promoted. If you don't believe that it helps, well, it definitely cannot hurt. So just do your part for the community.
Absolutely, absolutely. And we know healthcare workers, doctors in hospital, nurses wear masks for hours, 12, 13, 16 hours in a row. And they're there to help people in need. And if they can wear a mask for 12, 14 hours, others can do the same. From the clinical perspective, you sit in the clinic?
I agree 100%. If you look at the number of cases in our community, obviously we've been on a downward trend. A large part of that is simply due to masking. There was a mandatory order that was in place. People are now wearing masks. You definitely see people not wearing masks, but I think that's definitely the minority. And the majority of people really are adhering to what we recommend. And I've said it before. If someone came out with a pill or a vitamin today saying that I could decrease your risk of COVID by 60%, you'd have lines all throughout the building of people trying to get that pill. Well, we really do have that. That is simply a mask. It really is that simple.
Well said by both of you. And I was speaking with our guest before we began the transmission about Dr. Jerome Adams, who's the Surgeon General. And he said it this week, we have the tools to mitigate the virus already. Yes, we want the vaccine, it's coming up, but we already have the tools to do that. That's masking, physical distancing, reduce crowds, all of that. And of course, if you're symptomatic, you develop a fever, cough, now we must assume that it's COVID-19 until proven otherwise. Last year, fever, cough could be anything. Could be a cold, could be influenza, could be pneumonia. Now any fever and cough is COVID until proven otherwise, so we need to test you. So it's really important to do all of that. So thank you for the comments and all of that. I want to mention briefly testing. We continue to test. Obviously, symptomatic people are at the top of the list. Fever, cough, shortness of breath, loss of smell, loss of taste, myalgia, chills, nausea, diarrhea. We know that. I think lately we realized that in order to keep our schools safer and colleges, we need to expand testing because they're crowded, they're together. And so we've been doing some of that work with our local schools. We've been very fortunate to have our schools help us with that. So we've expanded testing that category. It doesn't mean that we can lower our guard. I think testing is just a tool. We know the sensitivity of the test can vary based on various factors, maybe 70% or so, maybe more. But we do know that the turnaround time is really critical. And now we're getting our test back in a day. And I think we're also noticing that contact tracing needs to be done very, very quickly. So if we get the test back the next day, if we contact trace and if we test with some frequency in that group, I think we'll have a really good chance of reducing the virus spread. So we're still doing the PCR for the acute illness. Up until recent, we were doing the nasopharyngeal swab. Now we do the nose, we do the anterior nares, and very soon our work with ASU will start doing the saliva test for the more larger scale as schools reopen for the hybrid model. So testing is really important. It's not the sole way of mitigating this. You agree with that?
No, I agree. It's definitely a multi-layered cake that we're baking here in public health and response. It's no coincidence that some of the Asian countries that have done very well now had this multi-layered approach: the mask wearing, contact tracing, testing, and they implemented all these things basically simultaneously, and their rates of infection and death are extremely low.
Right, absolutely.
And also, you mentioned it, a big barrier, I think, for people not wanting to be tested is just how uncomfortable the nasopharyngeal test is. we've all had it done, but really they stick it way up your nose. But again, you mentioned the newer tests; they're not uncomfortable. It's just basically right inside the nose, or of course the saliva test. There really is no pain, so it is a lot different.
Right. Yeah. Thank you for those questions. So the first few moments, actually, before I do that, let me speak in Spanish for a moment. So, estamos hablando de la importancia de las pruebas de sangre, de las pruebas de COVID, la usamos en la nariz, pero ahora es la parte anterior de la nariz, no hasta arriba. Y es muy importante hacer la prueba aquellos que tienen síntomas, fiebre, tos, problemas respirando. Pero ahora estamos aprendiendo que aquellos que están en un lugar congregado, en las escuelas, en los dormitorios, es importante hacer la prueba de ese grupo. Continuamos trabajando con otros grupos de las escuelas para hacer la prueba. La prueba del anticuerpo no es tan útil para nosotros. Es muy importante desde el punto de vista de salud pública. Pero para nosotros queremos saber, en este momento la prueba del RNA nos detecta infección activa. No se recomienda repetir la prueba después que el paciente sale positivo, porque hay fragmentos de RNA que permanecen en el cuerpo. Nos interesa saber si hay virus presente, y sabemos que probablemente después del día 10 o 12 que empiezan los síntomas, ya no hay mucho virus detectable. Es importante saber las indicaciones para la prueba. So lastly, I want to touch briefly on neurological complications of COVID-19, and I have received a few phone calls about patients who had sort of a more prolonged illness. I think that there's a name that they're
Long haulers. Long haulers, right?
I don't like that name, but I think this is more of a prolonged illness. We know the fatigue. We know something, but some people have been developing neuropathy, for example. Mostly a sensory neuropathy. We've seen that, meaning numbness, tingling of the legs and arms, because when we see those patients, we want to test for other causes of neuropathy, right? We do B12 testing, we do thyroid tests, so we want to rule out other things too. But after COVID-19, we've seen a few patients with sensory neuropathy, and the neurologist I consulted with recently said that he was seeing that too. Now, we don't know how long that's going to last, but that's something we've seen. And then a couple of things. There have been a few cases of what we call encephalitis, which is a condition in which the brain becomes inflamed, and it causes confusion, disorientation, delirium. And as we remember early on in the pandemic, a few reports where patients presented to the doctor's office just with the confusion, no fever, cough. The doctor had a high index of suspicion. They were tested and they were positive. So we know now that in some cases, the only symptom is confusion, nothing respiratory. So that's something to keep in mind. It's a sort of a delirium state. And then other patients get a more severe syndrome, acute disseminated encephalomyelitis, which is unfortunate. But then there's another syndrome called Guillain-Barré, in which is essentially the patient begin with numbness, tingling, but it's mostly essentially a motor disease. It's what we call an ascending paralysis. It starts typically in both legs, and then ascends up your body, and it causes usually respiratory failure over time. Not always, but it can do that. So those are the things we've seen. I think a lot remains to be learned in terms of treatment. Some of those patients are getting convalescent plasma, some are getting steroids. We do know that at least on the respiratory side of it, in the hospital, patients are treated with remdesivir, convalescent plasma, and dexamethasone. I think remains to be seen how these complications will be treated. I think we're just learning as we go with this illness, but these are neurological complications. Myocarditis has been reported too, particularly some athletes. Remains to be seen the effects of that and how it's treated. So that's essential. Acabo de repasar las complicaciones neurológicas de COVID-19. Encefalitis es una donde el paciente se presenta con confusión y delirio. Han habido casos donde el único síntoma es confusión. Luego encefalomielitis, que es algo más complicado, y el síndrome de Guillain-Barré, donde empezamos con debilidad en las piernas y asciende hacia arriba y causa parálisis de los músculos de la respiración. Hablamos de la prueba y ahorita le voy a pedir a mis compañeros unos comentarios finales. Any final comments as we conclude our morning session? Anything you want to share with your community about any of the topics we discussed? Masking, testing, contact tracing. Dr. Williams, you go
Sure.
first.
I think, as our number of cases continue to go down, a huge plea for members of our county not to get complacent and to make sure that you're still really vigilant, still wear a mask, still social distance, still do all the things that we still recommend.
Right. Fernando, what is your message to the community?
Everything that Dr. Williams just said also. In addition, please help us help you. When we're conducting investigations and we call you, please, it's not a scam. Give us the benefit of the doubt for a little while. We'll try to obtain information, and please just share as much as you're comfortable with. And it'll help us, help the community, help you, help your family.
Right. And this is a disease of all. Bottom line, it's not one person, it's all of us. Es una enfermedad de toda la comunidad. Fernando y su staff necesitan la cooperación de la comunidad cuando reciben llamadas de que fueron las personas que estuvieron a su alrededor para poder identificarlas y recomendar cuarentena o la prueba, lo que sea necesario. Marco, ¿tenemos alguna pregunta? No questions today, so I think with that we're going to conclude the transmission today. I want to thank Fernando. Fernando is a very busy person. I know his staff calls a lot of people every day to see how they're doing. So I want to thank you for that collaboration. And I also want to thank you from the very beginning. You were a great partner for us. Working on this together, it's been a difficult journey, no doubt about that. But we want to thank our partnership since March.
Yes.
We consulted a lot on each other. We reach out to figure things out, and we remain grateful for that. To you, your staff, of course, the director of the health department, Charlie Jacobs, and anyone working there. So thank you very much.
Thank you both.
I appreciate that. Dr. Williams, thank you for joining me. I want to thank Edgardo for putting this together, Marco for helping us, of course, Mariposa leadership for supporting this transmission. Thank you all. We'll see you next week. Have a great day. Hasta luego. Buenas tardes. Bye-bye.
Transmitiendo nuestra comunidad al mundo.